exactly 4 weeks after the Geneva Humanitarian Conference, the humanitarian crisis is growing in Afghanistan, and so is the United Nations' response to deliver for the Afghan people. The crisis is affecting at least 18 million people, half of the country's population. Despite financial shortfalls, logistical challenges, and an increasingly complex geopolitical situation, we are undertaking a massive humanitarian operation in the country. I am particularly proud of the work of our colleagues, the vast majority of whom are Afghan nationals. In September alone, more than 3.8 million people received food assistance. 21,000 children and 10,000 women received treatment for acute malnutrition. 32,000 people received non-food items, including blankets and warm clothes for winter. 10,000 children were reached with community-based education activities. 450,000 people were reached with primary and secondary health care. 160,000 farmers and herders were provided with livelihood support. 12,000 people received emergency psychosocial and mental health support. 186,000 drought-affected people received water, and 150,000 people received hygiene promotion and hygiene kits. Last week alone, WFP conducted simultaneous food distributions in Kabul, Herat, Mazar, and Kandahar in a single day. WHO delivered medical supplies to treat 10,000 people with acute watery diarrhea and opened 2 new COVID-19 labs. More than 170 UNFPA-supported family health houses in remote areas were provided medical supplies for services through the end of the year. These facilities, on average, enable around 11,000 safe birth deliveries each year. UNFPA also delivered emergency reproductive health kits for 3,100 women in Kandahar Regional Hospital and Kunduz Regional Hospital. UNHCR, UNICEF, and NGO partners reached well over 36,000 displaced and vulnerable Afghans during this week with core relief items and cash assistance. FAO and NGO partners delivered more than 870 metric tons of concentrated animal food. This is 1 week alone of work. UN agencies and humanitarian NGOs in Afghanistan are in a race against time to deliver life-saving aid to crisis-affected people and pre-position supplies ahead of winter. They won't let up. And they have been acting with the cooperation of the Taliban, who have progressively granted access to the areas requested and provided security when needed. The number of incidents during humanitarian operations has been in constant decline. Humanitarian assistance saves lives, but it will not solve the problem if the economy of Afghanistan collapses. We also need to make sure we do everything we can to prevent the economic collapse of the country. Already before the Taliban takeover in August, Afghanistan's fragile economy, which has been kept afloat by foreign aid over the past 20 years, suffered from the impact of drought and COVID. Right now, with assets frozen and development aid paused, the economy is breaking down. Banks are closing, and essential services, such as healthcare, have been suspended in many places. We need to find ways to make the economy breathe again. And this can be done without violating international laws or compromising principles. We must seek ways to create the conditions that would allow Afghan professionals and civil servants to continue working to serve the Afghan population. I urge the world to take action and inject liquidity into the Afghan economy to avoid collapse.